Welcome to Angel Health Academy. Topic for the day or topic for the session is steps in curriculum development or steps in curriculum construction. Curriculum development or curriculum construction is a systematic process that involves designing, organizing, implementing and evaluating the particular curriculum. Okay, curriculum development or curriculum construction means it is a systematic process. It consists a series of steps. Okay, a systematic arrangement of various steps that includes, okay, first one is designing the curriculum, second one is organizing the resources for the curriculum, okay, classroom, teachers, okay, etc., organizing the resources for curriculum, then implementing the curriculum, that is taking classes, that is both theory and practical sections, implementing the curriculum, and after the or end of the curriculum, evaluating the curriculum to check whether the goals and objectives are achieved or attained or not. It aims, curriculum development or construction aims to improve the total quality of the education or that education program and ensure that learning objectives are met effectively and efficiently. So we set learning objectives, both goals and objectives, okay, at the starting of curriculum planning. Then at the end we evaluate whether these objectives and goals are achieved or not, attained or not, okay, and make sure that students are attained or achieved all the learning objectives effectively and efficiently. Now let us talk about the steps of curriculum development or curriculum construction. There are 9 important steps in curriculum development or construction. First one is need assessment and analysis. So need assessment and analysis of that need. Second one is setting learning objectives, goals and objectives. Then content selection, that is a topic selection or subject selection and organization, arrangement. Then fourth step is choosing instructional strategies or method of teaching. Okay. Then fifth one is designing the learning experience and activities for the students. Then sixth step is developing various assessment methods to assess the achievement of the goals by the students. Seventh step is curriculum implementation. And eighth step is curriculum evaluation during and at the end of the educational program, curriculum evaluation. And last one is revision and continuous improvement of the curriculum, modification and update of the curriculum. That comes in revision and continuous improvement. Let us discuss in detail about the steps of curriculum development or construction. The first step is needs assessment and analysis. This step involves identifying or determining the educational needs of the students, teachers and the community or society. So first we have to identify what is the need for having a particular educational program. Okay. For example, B.Sc.nursing course. Okay, what is the need for the students? What is the need of the teachers in B.Sc.nursing program? And how it is benefited for the society or community. So, need assessment and analysis step involves identifying the educational needs or finding out the educational needs of students, teachers and the society or the community. These steps helps to determine what the gaps already exist in the present B.Sc.nursing program. Okay, that is in the current curriculum. And what new knowledge, okay, new subject, new theory or skills or competencies to be added or needed to be developed in the current curriculum. Okay. So for example, our syllabus, present B.Sc.nursing syllabus from 4-year program, now it is changed into semester system to 8 semesters. Okay. So we added many new knowledge and competencies for the development of the students. Thus we have filled the gap of the previous curriculum. Okay. That is the 4-year program of B.Sc.nursing. Now let us see what are the steps or sub-steps or actions for needs assessment and analysis. It includes data collection to identify the need. Then analysis of the data for the current trends of the healthcare services or B.Sc.nursing education program in India. Then third one is determine the scope and focus of this particular programs for a specific educational course like a B.Sc.nursing course. So first sub-step is collection of data, that is data collection. collect data from various sources, from the student performance, either previous nursing students, okay, or the current nursing students, student performance. Then teacher feedback. So teachers know that what is the advantages or drawback of this particular syllabus. So teacher feedback. Then from parents, their perception about this B.Sc nursing program, and from the society, okay, societal and industrial demands or needs for the nurses, okay, their services. So collect the data from various sources such as student performance, teacher feedback, parent input, and societal or industrial demands or needs or problems. Then second sub-step is analyze the current trends in education, nursing education, and job market, the job vacancy or employment opportunities both in India and abroad, okay, job market, to identify the relevant competencies, okay. So now after B.Sc nursing, students are working both in our country and they go to abroad. So the standards of practice in India and abroad is varies, okay. So the student should have the competency. The student should develop the competencies after this completion of this education program or B.Sc nursing program. The syllabus will be relevant according to the international standards. Okay. Then third one is determine. Okay. Find out the scope and focus of the new curriculum. What will be given in addition or more to the student from the previous curriculum. Okay. Whether the relevant competencies are applied. Okay. So determine, make sure that, ensure the standard and scope for the nursing profession and nursing standards. Okay. That is current health trends and current health practices both in India and abroad or Western countries. The second step is setting learning objectives. So after identifying the needs, after the first step, the specific learning goals and objectives or outcomes are defined for the B.Sc nursing program, current B.Sc nursing program. Okay. So after identifying the needs and analysis, we have to set the specific learning goals and outcomes or objectives. These objectives has to be articulate what students are expected to learn during this 8 semester program, okay, and achieve by the end of this 8 semester or by the end of the B.Sc nursing course. So these objectives has to be or in relation to, in association with what students are expected, okay, what they have to learn in the theory and practical, and what they have to achieve the skill by the end of the program or end of the particular course. The sub-steps or actions included: use framework to create the objectives, align learning objectives with the educational current or present educational and professional standards. Then third one is ensure that objectives address the 3 domains of educational objectives. I have already uploaded a video, 3 videos regarding the 3 domains. Okay. If you're really interested, you can watch and you can get the needed information about the domains of educational objectives. Now first step is use framework, that is theoretical framework or conceptual framework such as Bloom's taxonomy. I have already uploaded the Bloom's taxonomy of objectives of education. You can go through that. To create objectives that must be SMART. Okay. SMART means S stands for objective must be specific, M stands for it must be measurable, A stands for achievable, and R stands for relevant or appropriate, and T stands for time bound. We have to finish within that 4-year program. Or students has to achieve the needed knowledge at the end of the first semester, second, third, fourth, like that. Okay, that is time bound. So within 8 semester, they have to get adequate level of knowledge and competencies. So use the framework, okay, that is conceptual framework or any theory, any model. Here we are using Bloom's taxonomy in developing the objectives for the educational program. Second, align learning objectives with the educational standards and professional standards of nursing, what expect the public, okay, such as both national and state curricula. Okay, it has to be in association with, in relation to national curriculum and the state curriculum. Wherever applicable, we have to make appropriate, because students has to work both in our countries and even in abroad. So the curriculum has to incorporate with or align with the national and state curriculum. Okay, and wherever applicable, it has to maintain the professional standards and nursing standards with the selected with specific learning goals and objectives. Third sub-step is ensure that the objectives address the three domains of educational objectives, such as cognitive domain, that is knowledge, affective domain, that is attitude, positive attitude, and last one is psychomotor domain, that is skills, adequate nursing skills. Okay, so ensure that the objectives address clearly based on the or to develop the three domains in the students, such as cognitive, affective, and psychomotor domains. So when we set the goals and objectives for the nursing program, we have to make sure that that objectives ensure or it makes sure that students are achieving or developing the needed cognitive, affective, and psychomotor domains to render the quality based patient centered nursing care after the particular education program or B.Sc. nursing program. Then third step is content selection and organization. So subject and topic selection and organization in the education program or in the curriculum. These steps involves selecting the subject matter, needed subject matter, okay, and topics to be included in the particular curriculum. The content should be aligned with the balance with the based on the set learning goals and objectives, and should be relevant. It should be appropriate. It should be up to date. Okay, current. Okay, up to date as per the current healthcare trends or healthcare delivery system, and appropriate for the target audience, the students, B.Sc. nursing students. Okay, so the content should be aligned with the learning objectives and should be relevant, up to date or update, and appropriate to the target audience. Then actions include identify the key topics, themes, and various skills, okay, clinical and field practices. Organize the content logically, okay, systematically. Then consider the cross-curricular or interdisciplinary connections. So these are the three sub-actions under content selection and organization. First sub-step is identify the key topics, themes, and skills that support the learning objectives. Okay, already we set the learning objectives, but that has to be supported by including the specific topics, themes, and skills that's needed for that particular educational program. Second, organize the content logically and systematically, either chronologically, first year, second year, third year, fourth year, like chronologically, or thematically, okay, according to the theme or according to the complexity, that is simple to complex or basic to advanced. Like that, we have to arrange the topic or subject in the first semester, second semester, third, fourth, fifth, sixth, seventh, and eighth, like that. Then third sub-step is consider including cross-curricular or interdisciplinary connections where is appropriate. For example, anatomy, physiology, microbiology is in the first semester and third semester. That is connected with the third semester and fourth semester medical surgical nursing or adult health nursing. Okay. Then communicable disease and non-communicable diseases dealt in adult health nursing is connected with the fifth semester and seventh semester community health nursing. Like that, there are cross-curricular connections or interdisciplinary, that is medical surgical nurse specialty or department, okay, in nursing or adult health nursing subject is connected with the anatomy, physiology, and microbiology subject. Okay, then medical surgical nursing, communicable disease, non-communicable disease, etc. connected with the community health nursing. Okay, then MCH in OB, obstetric and gynecology, also connected with the community health nursing. Like that, there are cross-curricular and interdisciplinary connection of the subject, okay, that wherever appropriate it has to be connected. So students should have a coordination from first semester to second or second semester to third, like that, or 1 year first year to second year to fourth year, like that. Okay, there would be a connection. Then fourth step is choosing the instructional strategies or different method of teaching. This step decide how the content, whatever we are planned in the last step, will be taught in the classroom or in the clinical setting. Okay, instructional strategies refers to teaching methods or methods of teaching. Okay, and various approaches that will best facilitate the learning in the students and which help the students to achieve the objectives at the end of the programs. So here we choose the different types of or different styles of methods of teaching, like lecture method, panel discussion, symposium, okay, group discussion, project work, etc. Okay. The action includes first sub-step is select appropriate teaching methods. Consider the use of advanced technology and digital tools or software and applications. Then third one is ensure instructional strategies or method of teaching accommodate with different learning styles and needs of the students. First sub-step is select the appropriate teaching method such as lecture method, discussion method, project based learning, okay, dividing the students and giving the project, then collaborative or teamwork, okay, as a group work, okay, etc. In community health nursing and all, we focus the various group health education session and healthcare exhibitions, school health program, etc. like that, okay. So select the appropriate teaching methods, okay. That may be lecture, that may be discussion, or that may be panel discussion, etc. Okay. The second sub-step is consider the use of advanced technology and digital tools, okay, to enhance the learning. Okay. The current technology, even artificial intelligence also can be used in teaching and for selecting methods of teaching, and that may enhance the update knowledge of the students. Okay. Ensure that instructional strategies accommodate different learning styles or different learning methods and needs, which include the differentiated or different type of the instructions or classes. Okay. That will make a different feeling and enjoyment in the students to complete the needed theory and clinical practices with the various assignments. Then fifth step is designing various learning experiences and activities for the students. Defining learning experiences and activities. So this particular step, that is designing the learning experience and activities, develop specific tasks, okay, exercises and learning activities for the students that will engage the students and which will help them to apply their knowledge, that is theoretical knowledge, in the different sections or different areas of the educational program. So develop the specific task, exercise and learning activities based on the set goals and objectives to complete the particular educational program. Okay. These activities should encourage active learning. Students has to learn self by referring the books in the library. Okay. Active learning. Then critical thinking, logical thinking, okay, whenever they need to think and make decisions, and problem solving, okay, whenever any situation comes in the clinical side or in the community field. So these all learning experiences and activities should encourage the students to have or to make active learning, critical thinking and problem solving technique. This has to be developed in the students from the designing of learning different experiences and activities throughout the educational program or nursing education. The steps include or sub-steps include or actions include create a variety of activities, okay, during the complete course of the program. Incorporate the experimental learning opportunities during the 4-year programs or 8 semesters program. Ensure that the activities are scaffolded, that is moving from simple to complex, okay, 1 year to other year, 1 semester to other semester. So the first action or the sub-step is create a variety of activities that has to be aligned, that has to be balanced with the set learning objectives such as group project, okay, case studies, care plans, lab experiments, simulation activities, simulation techniques, okay, use of skill lab, then debates between the students and even for natural learning, that is through field trips, okay. Then incorporate the experimental learning opportunities whenever or wherever applicable, okay, such as internship. Of course, according to the current syllabus, 8 semester students are having internship programs. They learn more in the clinical settings. And simulation technique, okay, application of simulation in the skill labs, okay. So incorporate or include experimental learning opportunities during the 8 semesters program or 4-year program such as internship, simulations, wherever and whenever it is applicable. Then third sub-step is ensure that activities are scaffolded, that is moving from 1 year to other area, building on previous knowledge, okay, connection with the previous topic, previous subject and previous knowledge, that application into the next year, and increasing in complexity over the time. By the end of the 8th semester, students should know all the complexity or complicated topics, okay, and the patient care, all the senior nursing procedures to be rendered in the hospital setting for the welfare of the patients, okay. So ensure that activities are scaffolded, building on previous knowledge and increasing in complexity over the advancing the next level of the year or semesters. The sixth main step is developing assessment methods, various assessment methods. Assessment is essential for measuring the student progress because they have to complete first semester, second semester, third, like that. First year, second year, third year. We have to evaluate their progress. Okay. For that we need a different assessment method. Thus, assessment is essential for measuring student progress and determining whether they have achieved what they have achieved in relation to various learning objectives of the particular year or particular semester. This step involves selecting the appropriate methods of evaluating the students' knowledge, student skills and students' attitude. So we have various assessment tools, okay, through which or with the help of them we can evaluate the students during the study period or at the end of the particular year or semester. That include formative and summative evaluation. The actions or sub-steps of this step is called develop both formative and summative assessments. Formative is nothing but that is ongoing, okay, during the period of the year or semester. At the end of the semester or at the end of the particular year, the assessment, that is university examination, is called summative assessment. Okay, so unit test and all comes under formative assessment. Then second, ensure assessments align with, okay, balance with the current or set objectives and goals and the content or subject. Include a variety of assessment types, different type of assessment, because we have to assess both cognitive, skill and attitude of the students. Then fourth one is create a rubrics and clear criteria. So the sub steps or action include, first one is develop both the formative and the summative assessment. So formative is an ongoing assessment during the period of the semester or period of the year, such as conducting quiz programs, exams, unit test, okay, then project work and presentations, okay, individual presentations, clinical presentations, etc. Summatives at the end of the semester, like university exam, that is final exams, okay. So ongoing evaluation by conducting unit test and summative evaluation or assessment with the final model exam and university theory and practical examinations. Then ensure assessments align. These assessments align or balance with the set learning objectives and subject content of theory and practicals. Then include a variety of assessment types, different types of assessment to measure different learning domains like cognitive domain knowledge, affective domain that is attitude, and psychomotor domain that is skills. Okay. For example, for a psychomotor domain, we can use the checklist, okay, to assess the performance of the students in a particular nursing procedure. The last one is create rubrics. Rubrics is nothing but setting the rules for the procedure. So checklist could be used for step by step, or scientific principles can be evaluated during the procedure. Okay. So create rubrics and set criteria, clear criteria for the evaluation, especially for the nursing procedures. Okay. Seventh step is curriculum implementation. Now everything is we are planned, now we have to implement the curriculum. Okay. This step involves putting the curriculum into actions. Okay, implementation in the classroom or in the different learning environment, in the nursing labs, foundation lab, okay, skill lab, and even in the hospital settings, okay, in the different wards, okay, different departments. So this step involves putting the curriculum into action, both theory and practices, with using different methods of teaching, either in the classroom or in the different learning environment like a community, that is a field, or in the skill lab for the demonstration and written demonstration of the various procedures. Then curriculum implementation includes training the teachers. So teachers also has to be develop the knowledge how to use the different methods of teaching, how to take the classes in different teaching strategies. Then ensuring the available resources, okay, the classrooms, labs, libraries, okay, skill lab, etc. And delivering the planned lessons as per the master rotation plan with the lesson plan and clinical rotation plan to complete the clinical requirements of the students. The actions or sub-steps include train teachers or instructors according to the different method of teaching to complete the theory and practicals. Then provide the necessary resources, okay, that is man, money, material, faculty or the staff, then articles in the foundation lab, available books in the libraries, etc. Okay, so provide necessary resources, then monitor the implementation throughout to achieve the quality in education. So first action or sub-step is train teachers or instructors on the new curriculum. Okay, curriculum may be changed. Now this is the new curriculum. We are implemented many things. Okay, so introduce the instructors or teachers about the current curriculum, its objectives, and what it is demand at the end of the particular programs or educational program, including the instructional strategies, different methods of teaching and different assessment of methods. So teachers should know that how to assess in the different assessment methods. For that they should get a clear-cut training, okay, or periodic in-service education. Then provide the necessary resources such as available textbooks, current textbooks, digital tools or digital media, digital library, etc. Okay, and even lab equipment for completing the demonstration and the written demonstration of all the students in the particular year or semester. So required sets of the equipment or articles in the lab. Then last sub-step is monitor the implementation, okay, throughout the implementation to ensure or make sure that it follows as per the plan, okay, through the lesson plan, okay, through the master rotation, okay, through the clinical rotation plan, etc. And adjust wherever it is needed, okay, or whenever it is needed, okay. So monitor the periodical monitor or continuous monitoring of the implementation of the curriculum and make sure that it follows as per the plan, okay. Make adjustment as it is needed when and wherever it is needed. Then 8th step is curriculum evaluation. Now implementation is over. Next we have to evaluate. Evaluation is a critical step, important step to assess the effectiveness of our implemented curriculum and its impact on the student learning, whether it is having positive impact or negative impact. Okay, that has to be assessed, okay, through evaluation. It involves gathering the feedback, okay, information from the students, from the teachers and other stakeholders, okay, the management of the particular hospital organization, okay, and analyze this data, this collected data from students, teachers and the other stakeholders, analyze the data to determine, to find out whether the curriculum meet its goals already set or objectives which is already set as SMART. The sub-steps or actions include use both the formative and summative evaluation techniques. Okay, compare students' outcomes, that is positive and negative outcomes. Then identify the areas of their success and where they need improvement. Okay, that is area need improvement. So first sub-step is use both formative, that is ongoing, and summative, that is end of the course. The final evaluation techniques such as survey by asking question to the students, focus group discussion, okay, discussion with a particular batch or particular semesters, and the test result of the unit test, sessional exams, model exams, etc. Okay, then compare the students' outcomes with the original learning objectives. We already set the learning objectives. In that we mentioned what would be the outcome of the students. That has to be compared with the student current outcomes. So compare the student outcomes with the original learning objectives and goals. Then identify areas of success, or which are the area they have a successful development and which are the area they need further improvement. Okay, that is areas needing improvement. That area have to concentrate more and we have to make a different implementation and different method of teaching or instructional strategies to improve the or make the students to develop in that particular area. Then the last step is revision of the curriculum and continuous improvement of the curriculum. Revision and continuous improvement. This is based on the evaluation result. Okay, the feedback. The curriculum is revised to address any gaps, if there is any gaps, okay, drawbacks. Any challenges has to be faced, okay, or any opportunities for improvement for further success of the students, okay. This ensures that curriculum remains relevant, appropriate and effective according to the current healthcare trends, healthcare practice and current nursing education. The sub-steps or actions include make necessary adjustment in the curriculum, continuously monitor the curriculum and update the curriculum. And last step is engage in an ongoing cycle of evaluation and revision of the curriculum. That is ongoing evaluation and revision, periodical revision of the curriculum. So the first step is, or first sub-step is make necessary adjustments. Make necessary adjustment to the content of the programs. Okay, that is theory. Instructional strategies, methods of teaching. or evaluation, that is assessment, based on the feedback from the students, teachers, stakeholders, etc., and based on the evaluation or assessment data. Continuously monitor and update the curriculum, okay, to ensure it remains the balance or aligned with the current educational standards or nursing profession standards and current technological advancement and current societal needs, okay, needs of the society and community in relation to healthcare services and in relation to nursing education. The last one is engage in an ongoing cycle of evaluation. It is like a nursing process. Okay, after the implementation, we go for evaluation. Again, we have to start the assessment. So, ongoing cycle of evaluation and we revise, revision to keep the curriculum current and update and responsive to the based on the needs of the students, based on the current trends of the healthcare and based on the current education needs of the B.Sc. nursing program. So the summary of the steps of curriculum development include, first one is need assessment and analysis. Here we identify the gaps from the previous curricula and we have filled the gap. And educational needs also we have find out based on the current needs. Second is setting learning objectives. So define what students should achieve, according to that we have to make different goals and objectives. Third step is content selection and organization arrangement. So choose the appropriate subject, okay, theory and practical, and structure the relevant topic, okay, and organize the resources necessary for to complete the particular programs. Then choosing various instructional strategies or methods of teaching that decide how the content will be taught during the particular program of 8 semesters or 4 years. Then fifth step is designing the learning experiences and activities that is necessary to engage the students throughout the education programs. So develop various tasks to engage the students in each semesters and all the years of the B.Sc. nursing program. Then sixth step is developing various assessment methods. So plan how to measure the students' learning, both formative and summative assessment. Then curriculum implementation. Put the curriculum into practice or into action. Then curriculum evaluation. After the implementation, evaluate the curriculum. That is assess the effectiveness of the curriculum. That also both formative and summative evaluation with the different evaluation methods or tools. Then ninth one is revision and continuous improvement of the curriculum to upgrade the standard and reputation of the nursing profession and to maintain the standards of nursing profession. So update the curriculum based on the feedback and the data collected during curriculum evaluations. So sometimes there would be a question like steps in nursing curriculum development. So curriculum development steps and nursing curriculum development step is same only. We have one additional step like a second step, that is define the philosophy and mission of the institution. Okay, so institution make their own philosophy, okay, to achieve the ultimate goals and objectives of the programs. And based on the philosophy, they make their own missions to complete the philosophy or to achieve the goals and objectives. Like that we have one more step, the total step will be 10. Okay, remaining all the steps are same only. We can write the same if you have a question like steps in nursing curriculum development. So far we have discussed in detail about the content of steps in curriculum development or steps in curriculum construction. So there are 9 important or main steps and each steps have many sub steps. Okay. Hope this video really benefits in your studies and exams. If you feel it is really worth and beneficial, please like, share and subscribe my channel and stay tuned with the Angel Health Academy for the next 10 important academic video, and convey your gratitudes and regards in the comment sections. And once again, thank you for watching my video. See you and take care.